welcome to ArtBeat, keeping a finger on the pulse of arts and health research. I'm Natalie Rella with the UF Center for Arts and Medicine. Fresh bread, warm muffins, a homemade meal. Turns out baking and cooking each week could be a recipe for better mental health. A study from the EpiArts lab looked at over 19,000 adults age 50 and older in the United States to understand how creative hobbies like baking, cooking, crafting, or joining a creative social club impact depression over time. Researchers followed participants for 8 years, measuring both their activities and their mental health. The results are pretty spicy. Weekly hobbies or projects cut the odds of depression by about 20%. Joining creative and social clubs lowered depression by up to 22%. And the big one? Adults age 50 to 59 who baked or cooked something special every week had a 30% lower chance of depression 2 years later. Researchers suggest it's not just about mixing ingredients, it's about connection. People in their 50s and early 60s may be more likely to bake or cook for their friends and family, turning a simple hobby into a form of social bonding. That extra ingredient of connection may guard against loneliness and depression. So the next time you step into the kitchen, remember, cooking up something special isn't just tasty, it's also nourishing for the mind. To read the full publication, visit @UFCam on Instagram or Facebook. This segment features research from the Center for Arts and Medicine's EpiArts Lab, an NEA research lab in partnership with Dr. Daisy Fancourt at the University College London.